Good day everyone, it's me again, Gary. For today we're going to talk about adjustment disorders. Before we proceed, I would like to invite everyone to please subscribe to my channel. Press on the subscribe button so that you'll be able to get my latest videos on mental health, psychology, and other stuffs. So let's talk about adjustment disorders. Now let's give a definition to adjustment disorder. When we talk about adjustment disorder, it is a group of symptoms such as stress, feeling sad or hopeless, and physical symptoms that can occur after you go through a stressful life event. So merong stressful life event, you are able to experience that, you'll be feeling stress, you feel sad, there's hopelessness, and of course there's physical symptoms. Masakit yung likod, masakit yung katawan, nahihilo, sakit ang ulo, and other parts of the body that would have a physical symptom. The symptom would occur because you are having a hard time coping. Nahihirapan ka mag-adjust to whatever situation that you're able to have. Your reaction is stronger than expected for the type of event that occurred. So, nagkaroon ng event, the reaction that you're doing is much stronger. Mas aggravated siya than what is supposed to be expected from the event. Adjustment disorder are stress-related conditions. So there's always the presence of stress. It is on the person having difficulty being able to adjust. You experience more stress than would normally be expected in response to a stressful or unexpected event. And the stress causes significant problems in your relationship, both at work or at school. Dahil nagkaroon ka ng stressful or unexpected event, you would be having to feel stress. But normally, there should be a normal level that it would occur. But on the situation of adjustment disorders, you would have different ways of coping, and at the same time, you will be able to raise out significant problems in your relationship. Nagkakaroon ng diferensya with the way you relate with people at your work or at school because of the stress that you're able to have. Ibig sabihin po, nahihirapan po kayong magkaroon ng adjustment doon sa mga stressful situation that you're able to incur. Some people react to a major stressor in their lives with extended and excessive feelings of anxiety, depressed mood, or antisocial behavior. Nagkakaroon po ng event ng ganyan. Iba-iba pong tao, iba't iba pong ways kung paano nagre-react sa iba't ibang mga experiences na pumapasok sa kanilang mga buhay-buhay. The symptoms do not quite add up to acute stress disorder or post-traumatic stress disorder, nor do they reflect an anxiety or mood disorder. So, eliminate po natin lahat ng acute stress disorder, post-traumatic stress disorder, anxiety or mood disorder. That does not reflect on the idea of adjustment disorder. But they do cause considerable distress or they may interfere with a person's job, schoolwork, or social life. Katulad po ng ibang disorder na sinasabi po natin, nahihirapan po mag-adjust ang isang tao sa kanyang school, sa kanyang trabaho, or sa kanyang social life. And because of this, nahihirapan po siyang mag-adjust, nagkakaroon ng considerable distress or interfere. Kaya po siya nagiging disorder. Should we consider such reaction to be normal? Ang sagot dyan ay no, hindi. Kasi it's a normal thing among us to be able to adjust well to different stressors and to the different situations in life. But when a person has adjustment disorder, nahihirapan siya makapag-adjust and therefore, we would not consider it to be normal. Meron pa. There are some actions or behavior that you might manifest. Ito yung mga pwedeng lumabas, may pakita mo at the time that you're having your adjustment disorder. Feeling sad, masyado ka nalang malungkot. Sometimes with no apparent reason, bigla na lang aatake ang sadness. Hopeless or not enjoying things. Dati-dati nag-i-enjoy ka sa mga bagay-bagay, ngayon bigla na lang nawala, and at the same time you lose hope. There's frequent crying, bigla ka na lang naiiyak or umiiyak ka na lang bigla ng minsan walang dahilan. It's very difficult for you to be able to express or to be able to feel out what you would want to happen at the time of adjustment. Pero dahil hindi mo siya kayang i-organize, you would be having frequent crying. There's also worrying or feeling anxious, nervous, jittery, or stressed out. Wala lang, ayaw mo na lang biglang kumilos, you become anxious about things, you start to worry, bigla ka na lang kinakabahan, bigla na lang ayaw mo kumilos, ayaw mo na makihalubilo, and the end of it, you stress out. There's also trouble sleeping, nahirapan ka makatulog, nagkakaroon ng adjustment, we are capable of handling it, pero this time around, because of the adjustment disorder, you have difficulty sleeping, nahirapan ka because you have been troubled. And because you have been troubled so much, pati pagtulog mo na apektuhan na. There's also the lack of appetite, hindi ka na makakain. Ayaw mo nang kumain, or hirap na hirap kang magkaroon ng gana para kumain. There's also difficulty concentrating, yung focus nawawala. Hindi mo mai-focus yung gagawin mo at hindi ka makapag-focus sa mga bagay na dapat mong ginagawa. There's also the feeling of overwhelm. Yung senses mo, parang lahat na lang ng mga naririnig mo na occupy ng senses mo, it becomes exaggerated. Kasama po dyan kahit mahina lang yung music, feeling mo ang lakas-lakas, yung mga ilaw, nasisilaw ka masyado, and later on napapagod ka, nakakatingin. Because your sensation has been overwhelmed. There's also the difficulty functioning in daily lives. Yung mga normal niya naman pong ginagawa araw-araw na routine, hindi mo na magawa. Those daily activities that you would want to do. Why? Babalikan ulit natin. There's a stressful event in life, you would want to adjust, and because of the adjustment disorder, you would now have difficulty functioning. You also withdraw from social support. Ayaw mo na makipag-usap sa mga tao. Ayaw mo na kausapin yung mga dati mong kinakausap naman who gives you social support. Yun yung mga tulong na pag nakakausap mo sila, you feel better. Pag nakakausap mo sila, you feel good. But this time around, you withdraw. Then there's also the avoiding of important things. Yung mga importanteng bagay tulad ng trabaho, tulad ng pag-aaral, tulad ng mga bagay na dapat mong ginagawa. At the time of adjustment disorder, bigla ka na lang nawawalan ng ganang gawin ng mga bagay niya. And of course, last one, sana naman hindi tayo umabot sa ganitong mga behavior, suicidal thoughts or behavior. Lagi po natin tatandaan that suicide is not the solution to anything. Right? Nagkakaroon ng urge, nagkakaroon ng feeling to be able to do such, pero I tell you, it's not the solution. You have other things that you can solve too. Ano yung cause niyan? Saan ba nagmumula yung adjustment disorder na yun? Typically, adjustment disorder are caused by significant changes or stressors in life. Nagkaroon ng significant change, life-changing. Pwedeng bigla kang nagkaroon ng trabaho. Nung nagkaroon ka ng trabaho, biglang dumami ang responsibility mo. Kahit sabihin natin nanalo ka sa loto, you won in a lottery, pwedeng magbago ang lifestyle mo because of that, and it becomes stressful. And because of that, hirap kang mag-adjust. Pwede rin siyang genetics. Based on your life experiences, your temperament may increase your likelihood of developing an adjustment disorder. Pwedeng genetics. When we talk about genetics, we're talking about risk. Hindi automatic na magkakaroon ka ng adjustment disorder. What we're talking about is baka magkaroon ng risk. You have higher or you have an increased chance in your likelihood of developing an adjustment disorder because you are able to acquire the symptoms, the behavior from your parents or ancestors. Ang pinag-uusapan natin dito is somewhere between effective coping strategies and stress disorder lie the adjustment disorder. We have coping strategies, we have ways, effective ways to cope up with whatever's happening with us. Tapos meron namang stress disorder in between. If we're able to succeed and be able to overcome adjustment disorder, then we're able to cope. If not, then we go to stressful disorders. The essential feature of adjustment disorder is the development of emotional or behavioral symptoms in response to an identifiable stressor occurring within 3 months of the onset of the stressor. So these symptoms or behavior are clinically significant as evidenced by one or both of the following. Mark distress that is out of proportion to the severity or intensity of the stressor, taking into account the external context and cultural factor that might influence the symptom severity and presentation. Also, there is a significant impairment in social, occupation, and other important areas of functioning. Isa dun sa dalawang yon. If the person has, number one, sa culture nila, normal na nangyayari yan, pero iba yung way of reaction niya, or nagkakaroon na siya ng impairment. Ibig sabihin, hindi na siya nakakapag-function maigi sa kanyang social, occupational, or other important areas. Sa school, sa bahay, sa community, and other areas that the person is supposed to be functioning well. Pag merong isa o dalawa yung parehong yan, more or less, we're talking about adjustment disorders. The symptoms do not represent normal bereavement. Hindi po kasama dyan ang grief. Halimbawa po, namatayan po siya ng mahal sa buhay, namatayan po ng kamag-anak, hindi po siya pwedeng mag-fall under the adjustment disorder because it would fall under grief, and at the same time, it would not represent normal bereavement ng adjustment disorder po natin. If the person has someone who just passed away, namatayan po yan, hindi po kasama yon. Yung mga once the stressor or its consequences has terminated, the symptoms do not persist for more than an additional 6 months. So kanina sabi po natin, lalabas po yung behavior, lalabas yung symptoms 3 months after the onset of the stressful event. So naging okay na siya, na-experience na niya yung stress, then after the next 3 months, ma-experience niya. Then, ito po, it would not persist for more than additional 6 months. After ng 3 months niya, the additional 6 months, hindi ho niya mararamdaman yung mga symptoms niya. The stressor has been terminated, but eventually after that, lalabas ulit at makaka-experience ulit siya ng tinatawag mong adjustment disorder. The adjustment disorder should not be diagnosed if the reaction to stress is, may dalawa po dyan, what might be expected given the situation. Halimbawa po, namatayan, normal po na malulungkot or iiyak. Nawalan ka ng bagay or gamit, nalungkot, iiyak. To the event that is presented, to the situation, you're expected to feel such. Tama naman yung reaction. And another thing that we have to look into to eliminate the diagnosis for adjustment disorder is when the person does not cause significant impairment in social or occupational functioning. Ibig sabihin po, if the person is still capable of maintaining social relationships, nakakapagtrabaho pa po ng maigi, nakakapasok po sa trabaho, the person may feel depressed, sabi may depressed ako or may anxiety ako, but they are capable of social or occupational functioning. So if these two has the presence of it should not be diagnosed as adjustment disorder. How can we prevent? Ito, there are no guaranteed ways to prevent adjustment disorders, but developing healthy coping skills and learning to be resilient may help you during times of high stress. Tataas yung stress, magkakaroon ng anxiety. In the previous video that I made, meron ako dyang, hanapin nyo lang po sa video natin, I was able to talk about anxiety attacks. When the person feels stress, when the person feels the anxiety, he should be able to go to his healthy coping skills. Anong ibig sabihin nun? Anong ibig sabihin pag nagkakaroon po tayo ng anxiety? Once that we have anxiety, titignan mo yung idea of how your body reacts to stress. And because your body tells you how to react, you would be prepared. Maghahanda ka, papaano mo i-cope yung sarili mo with the stressful event that would happen around you. If you know that a stressful situation is coming up, lilipat ka ng bahay, aalis ka, magre-retire ka, pupunta ka sa isang lugar na hindi ka siguro, or just merely having the stress. To prevent, we should be able to call on our inner strength. Everyone has that. Sabihin mo sa sarili mo, na kaya mo siya. To be able to recognize and realize, to plan to be able to cope up and to be able to recognize that these are the events that will be coming and it's very difficult. Increase your healthy habits and rally your social supports in advance. Nararamdaman mo na. Well, you have to look into your healthy habits, tapos kukontakin mo na yung mga taong importante sa'yo who would give you social support, your church, your community, and of course your family. And also, at the time that the stressful situation would come up, you always remind yourself that this is usually time limited and that you can get through it. Time lang siya. You would be able to feel stress on this particular time, na-stress lang ako. Bakit? Baka napapagod ka na, baka paulit-ulit yung mga ginagawa mo. Kaya nga importante that you should be able to recognize what are the things that would happen. Ano yung mga signs and symptoms na, uy, ayan na, nagkakaroon na ako ng stressful feelings, nagkakaroon na ako ng anxiety. Do I have to go out and to take a breather? Kailangan ko bang mag-divert ng aking attention, manood ng isang pelikula? That would be my capability to cope up. You have to remind yourself, kasi usually, tulad ng sabi natin, ang mga stress po is always time limited. Also, consider with your doctor or mental health professional to review healthy ways to manage your stress. Sabi nga po natin, we should be able to consult on professionals. Wala pong problema if you would want to talk to someone. If it makes you feel better, pwede po siya. But if you are able to have difficulties and it's very difficult for you to cope up, I think it's very advisable that you should talk to a doctor or a mental health professional so that they would be able to handle your situations well. So there you have it, our topic for today, adjustment disorders. I hope you were able to pick a thing or two about the discussion on the disorder. May I invite you to please subscribe to my YouTube channel. Please click the subscribe button and the bell button so that you will be able to receive the latest videos that I would do about mental health, psychology, and other stuffs. Thank you for watching and stay safe. Alam na dis.